So the biggest benefits to interprofessional collaboration in practice is really what it means for our patients. So we know that we are all better when we work together in an effective, really robust way. And in order to do that, we have to be able to train the next generation of clinicians in order to effectively work together to optimize the outcomes of our patients.
Interprofessional education and collaborative practice are enormously beneficial to the profession of optometry, our students and patients. Ultimately, being able to have the right provider at the right time, working together in close coordination, allows the patients to really benefit from an integrated system of care that enables them to have better healthcare outcomes.
In a competitive sport, you all are working for the same team. You know you have a particular role. There is no well-defined leader who takes the role for the entire team. You know, it's a shared responsibility, and you're trying to get the same goal achieved in the safest way possible.
It looks at the patient as a whole, and it brings the people around the table that are going to bring their skill sets to identify their areas of expertise, but then by coordinating with the other professionals around the table at the same time, it decreases duplication, cost, errors that can occur, and really just overall improves the patient experience and allows for the patient to work with a group and to be able to communicate with a group of people that are interested in helping them to achieve their best health.
You know what, I think interprofessionalism is so important to learn as students. It honestly teaches us to be good diagnosticians. It helps us look at signs and symptoms more wholesomely rather than in fragments. And I think it's essential for students to learn now so that they can build collaborative practices in the future successfully. I think that to be the most knowledgeable and to be the most efficient doctor that we can be, it means integrating other professions into the co-management of the patient.
I served on ASCO's Interprofessional Education and Collaborative Practice Committee for 3 years. And during that time, we collected data using a survey tool that we designed and implemented. And most schools are doing interprofessional education and collaborative practice at varying levels. For example, at Salus University, I am the coordinator and co-instructor for the Evidence-Based Practice course, which is a core curriculum course required for all students enrolled in the audiology, physician assistant, optometry, occupational therapy, and speech-language pathology students degree programs. So those students all together, not just sitting next to each other in a classroom, but actually are working at interprofessional teams, and they're assigned specific assignments and presentations, and are really working alongside, in addition to working with one another, they also are working with faculty mentors from the other professionals.
And so I think what we've finally sort of figured out as a group of colleges and schools is that breaking down those silos to collaboratively interact as students makes for better clinicians in the long term, and to really be able to educate our students in an effective way in an interdisciplinary environment makes for a really profound team approach when we get into the clinical setting.